We are following breaking news right now. New Jersey Acting Governor Sheila Oliver and other state officials are holding a press conference in Ewing to give an update on the coronavirus outbreak. Let's listen in.
Last night, along with Commissioner Persicelli, we identified our first presumptive case of coronavirus in New Jersey. That individual, a male in his 30s, is currently hospitalized and stable at Hackensack University Medical Center in Bergen County. We are working with our partners in New York closely to carefully trace all points of contact for this individual. Additionally, a second presumptive case has also now been identified. The Department of Health, along with our local and federal partners, is working hard in responding to these cases, and Commissioner Persicelli will speak more to both of these in just a moment. In addition, the administration has issued immediate restriction on all state-related business travel. All international travel is suspended for our state workforce until further notice, and previously approved international travel by our state employees is canceled. All domestic out-of-state travel on state-related business must be approved by the governor's office, including same-day travel, whether that be to New York, Washington, D.C., or elsewhere. And we advise caution of our employees traveling to any area with known impacts of community spread of coronavirus and COVID-19. I would like to reiterate two things that the governor and commissioner both said repeatedly on Monday. One, this case does not come as a surprise. Our state has been prepared for weeks for the eventuality that one of our residents would test positively for coronavirus. We put in place a plan for preparedness and rapid response, and that plan is working. As you know, Governor Murphy assembled an interdepartmental task force, and that task force communicates on a daily basis. Second, and more importantly, the threat to public health in New Jersey remains low. We urge residents to remain calm, and it bears repeating. This is cold and flu season, and residents with respiratory ailments are more likely to be suffering from a cold or flu, not coronavirus. Lines of communication remain open to all. Anyone with questions or concerns should first visit the Department of Health's coronavirus information page at nj.gov/health, or call the state's toll-free public hotline at 1-800-222-1222. And as a reminder, the surest way to protect yourself and others is to wash your hands frequently with soap and water, to cover your cough or sneeze, and to avoid touching your face, your eyes, your mouth, your nose. If you are feeling sick, take a day off from work or school and call your doctor or local health care practitioner. These are all simple things and common sense things, and they are our best defense. As we said, the overall risk of coronavirus is low. If you feel under the weather, it is most likely a seasonal cold or flu, not coronavirus. From the governor to me, Commissioner Persicelli, and to everyone that is standing up here with me, our teams across government, we have been preparing for this for weeks. And because of that, we are being aggressive in our investigation and in ensuring public health. I'm going to now ask Commissioner Judy Persicelli to further brief you.
Thank you, Acting Governor Oliver. As I said in the past, given the expanded testing and continued spread of novel coronavirus worldwide and in the United States, it would not come as a surprise that we would have a positive case in our state. We were notified last evening of our first case. I'm here to report this morning that we have just been notified that we have another presumptive positive case, which will be sent to the CDC for confirmation. When I say presumptive, I mean the sample was tested in our state labs in West Trenton and is being submitted to the CDC for confirmatory testing. State and local public health authorities are proceeding with their investigations and responding to these activities in our recent notifications. Here is what we know so far about the individual. The case is a male in his 30s who's currently hospitalized in Bergen County and is currently stable. The individual developed symptoms on March 1st and then sought medical care late on March 2nd, first at an urgent care facility in Bergen County, and then was sent to the hospital ED, emergency department, and was subsequently admitted. The hospital appropriately placed the patient in an airborne isolation room since his arrival, and the facility has since been continuing appropriate infection control precautions. From the time he became symptomatic, the patient had limited close contact with other New Jersey residents outside of the healthcare setting. The New Jersey Department of Health, in conjunction with the local health departments, are in the process of identifying healthcare, household, and other close contacts of these cases. These contacts would be assessed as to their level of risk of exposure to the case, and other close contacts would be asked to self-quarantine and monitor for symptoms for a period of 14 days. While we are still investigating the patient's possible source of exposure to the virus that caused COVID-19, at this time we do not have information linking this patient to the Westchester COVID-19 cases. I know even one case of COVID-19 is concerning to the public. There currently is not a vaccine to treat COVID-19, but there are steps you can take to protect yourselves. You've heard this repeatedly. Wash your hands frequently during the day for at least 20 seconds. Use alcohol-based hand sanitizer at 60%. Cover coughs and sneezes. Staying home when you're sick. Avoid close contact with people who are sick. Avoid touching your eyes, your nose, or your mouth. Add clean and disinfect frequently touched objects and surfaces using regular household cleaning spray or wipes. For individuals who have recently returned from China, Iran, Italy, and South Korea, where CDC recommends you avoid all non-essential travel, CDC and the Department of Health are advising that they self-quarantine, self-monitor, and practice social distancing for a period of 14 days from the time the individual left the area with widespread or ongoing community spread. Yesterday, we also issued a notice that any New Jersey resident who attended religious services or religious events at the Temple Young Israel in New Rochelle, New York, on February 22nd or February 23rd to self-quarantine until March 8th. Self-quarantine is an important public health tool used to separate and restrict the movement of people who may have been exposed to a contagious disease to see if they become sick. As COVID-19 spreads across the United States, we will expect to see more cases in New Jersey. Currently, we have 8 persons under investigation and awaiting testing. So far in New Jersey, we have tested 13 individuals. 11 were negative, and as of a half hour ago, 2 have been reported as presumptive positive. However, these numbers are changing rapidly as the number of providers contacting public health to request testing is expanding. The Department of Health has been monitoring this global outbreak since the first week of January to ensure our preparedness at all levels throughout the state. Our teams continue working around the clock to respond to this and any potential cases that come our way. Our internal management team continues to meet daily and assess our response. The New Jersey Coronavirus Task Force, chaired by me and comprised of other state departments and agencies, is coordinating all state efforts to ensure that we are taking a whole of government approach, as the governor says. We continue meeting weekly and working with each other on a regular basis. We've been hosting conference calls and meetings with local health departments, hospitals, school superintendents, and college presidents. Members of our business community have been on conference calls with us, and local and county officials have been in constant contact for our preparedness efforts. We continue working with these groups to address all of the stakeholders' concerns. We are planning more calls with stakeholders, such as long-term care facilities and child care centers, next week. Our coronavirus webpage, available at nj.gov/health, is updated regularly with FAQs, fact sheets, travel advisories, and guidance for businesses, universities, schools, and healthcare providers. We encourage residents with questions to call the public hotline run by New Jersey Poison Control Center at 1-800-222-1222. Trained healthcare professionals are standing by 24/7. They can answer your calls in a variety of languages. So far, the call center has responded to more than 1,400 calls. Again, while any case of COVID-19 in our state is concerning, most New Jersey residents are still at very low risk of contracting COVID-19. As we are still in the midst of flu season, it is more likely individuals with respiratory symptoms, such as sneezing and coughing and temperatures, have the flu or maybe the common cold. Unless you have traveled to impacted countries or come in contact with someone who is known to have COVID-19, your risk remains low. We cannot say this enough. Please protect yourself and others from the spread of respiratory viruses by washing your hands frequently for at least 20 seconds, using alcohol-based hand sanitizer, covering coughs and sneezes, and please stay home if you are sick. Again, we understand the public is concerned, especially now that 2 cases have been identified among our residents. But we have been and continue to take all steps available to us to protect our residents. Thank you.
Thank you, Commissioner Persicelli. And at this time, we will hear from Dr. Christana Tan, who is a state epidemiologist, and she oversees communicable disease services at the New Jersey Department of Health. Dr. Tan.
Thank you, and good afternoon, everybody. Just really briefly, the complete clinical picture regarding COVID-19 is not fully understood at this time, as we know. Reported illnesses have ranged from mild to severe, including illness resulting in hospitalization and death. And while information so far suggests that most COVID-19 illness is mild, a report out of China recently suggests that serious illness occurs in about 16% of cases, which means that the majority of cases do present more with milder symptoms. Older people and people with certain underlying health conditions like heart or lung disease, diabetes, seem to be at greater risk for serious illness. Worldwide, there have been very few cases reported in children, and of those reported, the illnesses have been mild. Much is also unknown about how the new coronavirus that causes COVID-19 spreads. Current knowledge is largely based on what is known about similar coronaviruses, which are very common. And generally speaking, coronaviruses are a common cause of mild to moderate upper respiratory illness. Most often, person-to-person spread is thought to happen among people who are in close contact, meaning defined about 6 feet with each other, occurring mainly through respiratory droplets produced when an infected person sneezes or coughs, similar to how influenza and other respiratory pathogens spread. So, again, this is a rapidly evolving situation, and risk assessment of COVID-19 will be updated as we have more information. And while we currently have 2 presumptive cases in New Jersey, the risk still remains low for our general population, but it is still slightly higher for those New Jerseyans who have traveled to areas where community transmission of COVID-19 might be occurring, and for those who have had close contact with confirmed cases. And the increasing number of cases in other states and now in New Jersey make it more likely that we will see more cases in the near future, particularly since more people are being tested, as the Commissioner had stated. New Jersey, we're no stranger to emerging infectious diseases. And as we are a hub for global travel, over the last 20 years, for example, New Jersey has seen imported cases of SARS, viral hemorrhagic fever, and Zika disease, just as kind of our more recent examples. And also, back in 2009, we experienced the H1N1 pandemic when over the course of a year, we had over 3,000 confirmed H1N1 cases, mainly impacting a younger population. Similarly, as COVID-19 continues to evolve worldwide and domestically, we are carefully monitoring the situation and learning more about COVID-19 every day and adapting what we need to do as needed. And right now, we are seeing that different areas of the United States are going through different state. There is evidence of sustained community transmission in which these states are taking additional steps to control COVID-19 spread. In New Jersey, we've just identified our first 2 presumptive cases. And here,
and we just heard from New Jersey officials on the coronavirus outbreak, who said there was a second presumptive case of coronavirus identified in the state.